Hello, my name is Nancy Wick, and this is my cardiorespiratory presentation on hypertension. The evaluation of blood pressure is essential in assessing cardiovascular health. It is used in screening for hypertension and for monitoring the effectiveness of treatment in patients with established hypertension. In the routine outpatient setting, blood pressure is measured indirectly. Thus, it is important that proper techniques be used in order to produce consistent and reliable readings. This is the human heart, which is affected by hypertension. Classification of blood pressure for adults over 18 years. As you can see on the graph, these are your normal ranges. Today, self-measurement of blood pressure is seen as the optimal goal in improving the compliance of the hypertensive patient, but it can only be reached by using well-trained medical staff. In this, the role of the nurse is particularly important. Cardiovascular risk in patients with hypertension. The major risk factors for hypertension are smoking, diabetes, dyslipidemia, anyone over the age of 60, someone with a family history of hypertension, and men and postmenopausal women. Target organ damage is heart disease, angina, left ventricular atrophy, heart disease, stroke, retinopathy, and peripheral artery disease. Lifestyle modifications for hypertension prevention or management. You need to lose weight if you're overweight, increase aerobic physical activity up to 30 to 45 minutes most days of the week, reduce sodium intake, maintain adequate potassium and calcium dietary intake, stop smoking, reduce dietary fat, take physician prescribed medications. This is a comic strip. Do I have high blood pressure? Well, I reviewed your readings and you uploaded through the web, and your average reading is below 135/85. These are the reference that I used in putting my presentation together. And now I'm going to demonstrate a blood pressure, taking a blood pressure. This is my patient, David. You want to clean off your stethoscope. You want your patient to sit straight up and with his feet flat on the ground. You want to put the blood pressure cuff on firm, but not too tight. You want to be able to get a couple fingers underneath there. Holding it in place. This is the gauge, and this is the cuff. You want to tighten it. Feel for the pulse. Put your blood pressure cuff, your stethoscope there, and tighten it and pump it up to 200. You listen for the first beat that you hear, and then the second beat, and then you open it up and release all the air out. And his blood pressure was 130/70. Do you take your blood pressure at home?
Yes.
And is that within the normal ranges for at home?
Yes, it is.
Thank you. That concludes this presentation.